Hi, good morning, Miss Hazia. So it's good to have you here
Morning.
today. Yeah, so I'm Julian, and today I am accompanied by my friend Pawi. So I guess first things first, Miss Hazia, could you kindly introduce yourself to our audience? Please let us know your name and also your current role.
Okay, hi Julianne and Bao Yi. It's my pleasure to be with you here. Okay, so a little bit introduction about myself. I am Hazia. I graduated from International Islamic University Malaysia in 2010, and then I just did my master's in 2022 in University College London. It is Masters in Clinical Pharmacy, International Practice and Policy. And currently, I am a ward pharmacist in ICU in Tower Hospital. It's a district hospital in the east coast of Sabah. So previously, my role was an infectious disease pharmacist in Queen Elizabeth Hospital, which is the state hospital in Sabah. So that's where I started managing HIV. Currently, I still run the HIV MTech clinic, but it is a much smaller setting compared to in Queen Elizabeth Hospital.
Thank you, Miss Hazia. And also it's very
Mm.
nice to hear from your job portfolio. So maybe I could hear a bit more. Maybe what is your responsibilities at work and
Mhm.
maybe what do you
Uh-huh.
do on a daily basis?
Okay, so as a ward pharmacist in ICU, early in the morning, I follow rounds with the consultant and the specialist, as well as the medical officers, houseman officers, and also nurses. So what I do is I go through their medications list and then make sure everything is correct, and then I will countersign so that my colleagues will know that all of the medications have been reviewed. So then after doing my ward rounds, usually when it's my turn to do the HIV clinic, I will go to the HIV clinic around at 9 to somewhere around 1 p.m. So that's when I see HIV patients. What we do is we do heart counseling for those who just started on heart, and also we do compliance assessment for those who are already on heart. And besides that, I also do counselings, inpatient counselings for HIV patients that are warded in the hospitals. Yeah.
Thank you. So maybe before
Mm.
we dive in a bit deeper to how a pharmacist's role, especially in HIV/AIDS, and maybe also
Mhm.
how we can link it better to also in your job portfolio. Maybe I also would like
Mhm.
to give the opportunity for the listeners also maybe to also understand what is the prevalence of and maybe the background of HIV/AIDS in Malaysia and maybe how things have changed over the year first.
All right. Okay. So, in terms of prevalence, according to the latest Global AIDS Monitoring Report, in Malaysia, it is estimated that there are around 85,000 people living with HIV. And we are actually seeing a rise in HIV cases, but then we are also making significant progress in managing HIV. So, for instance, like Malaysia, we are currently adopting the WHO recommendation to start antiretroviral therapy regardless of CD4 count. And also, viral load testing are widely available in government treatment sites. And I think another notable achievement is that in 2018, Malaysia was named as the second country in the Asia and Pacific region to achieve the elimination of mother to child transmission of HIV and syphilis. So this is actually achieved because we do early detection via antenatal screening, and then HIV exposed infants are given free antiretroviral prophylaxis, as well as free uh, feeding replacement for the first 2 years of life. So yeah, Malaysia is very committed in combating HIV.
That's nice to hear. Yeah, especially it's quite
Mm.
notable. But maybe I'm just curious also because like because of early detection,
Mhm.
especially I think you mentioned also one of the more key populations, especially is the infants, right?
Yes.
Yeah. So apart from maybe infants, or maybe you can elaborate more on infants, are there others groups that maybe are more vulnerable to HIV transmission? Then can elaborate on that and maybe what are the efforts to address their needs?
Okay, so in terms of key populations in Malaysia, initially when HIV was first detected in Malaysia, the driving population was the people who inject drugs, the PWID, and this was followed by female sex worker, and then transgender, and then finally men who have sex with men. But over the last 10 years, we are seeing a different pattern whereby sex transmission is the main driver of HIV in Malaysia. So your second question was how do we, can you repeat the second question?
Yeah, so my second question was more related to how do we address their needs, because I believe that these populations are quite susceptible also, and I think also the needs can comprise of many a lot of things, not only like medical, but I think also maybe like emotional, and maybe
Yes.
sometimes there's like this perceived notion of or
Mm-hmm.
of them having HIV AIDS. Yeah.
Yeah. Exactly, exactly. So, actually, for key populations, they have specific needs. So, in terms of addressing their needs, actually, for pharmacists, I think one of the most important thing is to build networks with the parties who can provide them with the necessary support. Okay, so even though there is a lot of things that we can do as pharmacists for our patient, but for certain needs, we need to build network with those who can provide them with the best support. Yeah, like the let's just leave the care to the experts for certain needs. All right, so because most of the time it is pharmacists who are the ones who identify these needs, because we see the patient more frequently, and then we have more time to talk to the patient. So, so then that's where one of our role plays, uh, whereby we need to connect the patient, um, so that they can be linked to those who can help with their needs. Yeah.
I think that's a very important um role that I think
Mm-hmm.
maybe sometimes we often undermine, because like as pharmacists we sometimes, and maybe especially maybe community, maybe even our day to day, we see patients quite often, and maybe sometimes we build that rapport with them, and then I understand more of their needs, and I think having connections is definitely very important. Maybe um
Yes.
i- referring them, if need be, to the necessary emotional support that they can get from voluntary groups, or maybe even
Yes.
sometimes NGOs. Yeah, yeah, I think that's definitely something to really ponder upon. Are there a lot of like maybe a bit more like extension on just wanting inquire more? Are there a lot of like maybe
Mm-hmm.
voluntary groups that maybe you have or have worked with, and maybe especially because you have a HIV clinic with in Sabah, is that right? So maybe like are there a
Yeah.
lot of voluntary groups such as that, or support groups also within the area?
Yes, we do a lot. We do have a lot of support groups, and then these support groups actually cover different needs. So some of them cover for PrEP, because PrEP is actually not offered directly from the Ministry of Health, but PrEP in Malaysia is actually a program initiated by the Malaysian AIDS Council in collaboration with the Ministry of Health. So yeah, we do have connection with the NGOs who are responsible for the PrEP. And then there are also other NGOs who focus on social needs, such as shelter home, such as those who provide financial aids, and then those who provide transportation and whatnot. Yeah, we do have. It's important not to work in silos, even though you are a pharmacist, but then you have to know what are the available resources out there that could aid for your patient's care.
I think, yeah. So I think especially knowing that there's so many support groups, and I think Malaysia has actually transverse and throughout their journey in the HIV AIDS landscape, actually like quite some
Mhm.
has made significant progress along the years. Especially I think you mentioned about it being the second country to achieve the eradication of mother to child transmission.
Mhm.
I think also I kind of want to know about more of its progress, because I believe the United Nations talked about the 95, 95, 95 goals. So maybe I could
Mhm.
understand a bit more in Malaysia. How has your work is achieved in this progress, and also what challenges may still remain that may be hindering from achieving better goals?
Okay, let's just go to the basic first so that your listener can have some context about the 95, 95, 95. Okay, so the 95, 95, 95 is a goal, is a target set by the UNAIDS to achieve to end HIV by the year 2030. So it means 95% of the people who live with HIV know their status, and then 95% of those who know their status are on treatment, and then 95% of those who are on treatment uh, achieve viral suppression. So in Malaysia, by December 2023, we are at 84, 68, and 89, which is, I think, quite impressive. We are on our way to the target 95, 95, 95. And in terms of the challenges in achieving 95, 95, 95, I would say initiating treatment and also retaining patient in care is one of the biggest challenge. Um, and this is actually influenced by several factors. For instance, stigma and discrimination is still widespread in our communities. So many are afraid of being judged or isolated by the community if they come forward to get tested or to get treatment. And then another thing is accessibility is also an issue in Malaysia. As you can see, the geographical situation in Malaysia differs by state. Like where I am, there are a lot of remote areas which is not accessible by car. So it is a challenge, especially for those who live in this area. So they might have to travel long distances to reach healthcare facilities. And then their transportation options are very limited. And then another thing is there are also patients who face economic constraint. Okay, so they might not be able to afford transportation. And then for some patient, attending clinic might strain their finances even further, especially for those who depend on daily wages. So yeah, those are the kind of challenges that we are seeing in achieving 95, 95, 95.
And maybe an extension on those issues that may be present.
Mhm.
And I think maybe not only have to be those in vulnerable populations or those maybe more
Yeah.
susceptible, but I guess in general for those patients with HIV/AIDS, what else can we do to overcome these problems, or maybe what can we do in the system to help better support these individuals?
Do you mean specific to those who live in rural and remote area, or just in general?
I think in general, but maybe we can. I think it's quite.
Okay.
Yeah, I think it's quite. I think it's a quite a novel thing to hear about the long distance also, because I also didn't think about
Yeah,
that because Malaysia is such a big country, right? So
exactly,
yeah,
exactly.
yeah.
Okay, so in terms of stigma and discrimination, we could help with the awareness. Okay, the awareness. So during each World AIDS Day, actually the MTech pharmacists usually will collaborate with the NGOs to do World AIDS Day celebration. So we normally do an exhibition. It could be in the hospital or outside the hospital. The ones that I attended before was one in a school in a district in Sabah. So it was quite fun. So what we do is we raise awareness among the public about HIV. We educate them on the mode of transmission, what is the signs and symptoms of AIDS, HIV and AIDS, and then what are the prevention method, and then what are the outlet that they can go to get tested and seek treatment if they are engaged to high risk behaviors. And in terms of accessibility, what we are doing in Malaysia, we do have some value added service to help patients to get their medications in the nearest rural clinic. Yeah, so those are among the efforts that we are doing to narrow the gap.
Also, oh, okay. So actually, I think that's quite nice also to raise awareness in school. Yeah. And
Mhm.
also, I mean, because like sometimes I think as young we're impacted by the media, especially
Mhm.
at early stages. So I'm just wondering, maybe also in that community sense, in I think because you mentioned also a school in Sabah, what about other individuals in, let's say, in the community? What about older individuals or maybe working adults? Ha- what else has been done to maybe give them a bit more awareness on this landscape as well?
Yes, we do a lot of what you call awareness programs for this kind of population as well. There are outreach programs that talk about a lot about HIV, and then there are an advertisement as well because we are seeing a lot more younger patients these days, and it's quite alarming that the newly diagnosed cases ages range around 18 to 25. So they have been doing a lot of public awareness through social media as well.
Do you have to deal with a lot of maybe misconceptions or with maybe young individuals or maybe even those from the public about HIV/AIDS?
You mean like if I meet any individual that have misconception on
Yeah,
my HIV patients?
yeah, yeah.
Oh yes, yes, there are a lot. Even when I first started, to be honest, I was afraid. I was actually afraid because it is pretty normal, to have that kind of fear because it is not really something that you were exposed to when you are a student. And then when I got the portfolio to manage HIV, I was afraid. But then I started to get to know my patient, and then actually there is always a story behind how they contract the disease, and we have no rights to judge them. So yes, even now I still do have people saying to me, "Are you not afraid managing HIV?" I just tell them that what you need to understand is that it is not easily transmitted. You cannot get HIV from communicating with the patient. There are other ways that need to be, like the transmission is through like blood, through sexual intercourse. So it's really safe to just communicate with my patient. So yeah, even in my daily conversation, if I do meet with the people with stigma and discrimination, I will try to make them understand that HIV is something that we can control nowadays, and that it won't spread easily to you. And all of us as public has have the responsibility to help curb the problem.
I like what you said about it's like addressing the fears, and I think also in a way also build and concerns, and also like I think when I was in Singapore we use something like ICE, because like we address like a patient's like ideas, concerns, expectations, and I
Yeah.
just in a way helps build their rapport, and also in a way show that we're alongside their journey, like to help curb any illness, any problem.
Exactly.
And I think especially for HIV/AIDS, where the stigma kind of remains a bit strong, although it's improving, but sometimes it is still a
Hmm.
bit prominent there, and a lot of
Yeah.
misconceptions that they might have. I think also because I think also in the road to try to curbing HIV/AIDS, a key issue that I guess maybe some patients face are maybe adherence, and I think also it could be also like worsened by because of these stigma issues, or maybe due to other factors
Hmm.
like economic that you mentioned just now. So maybe
Yeah.
what are there any programs that in Malaysia to actually help with improving this treatment adherence, maybe based on the certain issues? Or maybe do you think that there should be any new programs that can assist with this?
Okay, so in Malaysia, we have the Medication and Therapy Adherence Clinic for retroviral disease. So this is specifically designed to help with the adherence for the treatment in HIV. So I'm going to go with some basics so that your listener can see how this works. Okay, why adherence is important and is challenging for HIV patient. All right, so when a HIV patient is first diagnosed with HIV, the patient will undergo tests for infections, undergo screening for infections such as TB, hepatitis, cryptococcal meningitis, toxoplasmosis. Okay, so when any of these tests become positive, the patient need to be treated for the infection first. Okay, so you cannot start HAART immediately for patients who have infection. You can only start HAART immediately in patients who do not have infection. Okay, so this is because we want to avoid a condition called IRIS. Okay, IRIS stands for immune reconstitution inflammatory syndrome. So this is a condition that we want to avoid because when the patient is on HAART, the immune system starts to recover, right? So when the immune system starts to recover and you have not treated the infection, the immune system will react strongly towards the infection, causing the patient to become even sick. Okay, so we want to avoid that. We screen for the infection and treat the infection first. And then um, after we treat, and then starting HAART depends on which infection we are treating. Okay, so most opportunistic infection, we need to treat them at least 2 weeks before we can start HAART. Okay, so then 4 weeks for cryptococcal meningitis, and then at least 8 weeks for infection like TB meningitis. All right. So, and for some patient, they require secondary prophylaxis, which means that the patient will be put on antibiotics, antiviral or whatnot to prevent relapse. So the treatment can be very, very complex. Okay. So this is what we are doing in our MTech. So we do counseling for these patients. We last time we used to do pill counting, but now we are moving towards educating the patient so that we empower them to take responsibility for their health, which works really, really well for HIV patient because HAART is a long-term treatment. It's a lifelong treatment. So we need to empower the patient to take care of themselves. So that is one of our initiative in Malaysia. And also the support group, they are also very committed in helping with the adherence. Some support groups, they provide with pill training. Pill boxes. They provide free pill boxes to patients. And then some support group, they have like a WhatsApp group that will remind patients that it is now 9 p.m. So those who are taking medication at 9 p.m., please take your medication now, something like that. And then this WhatsApp group is very efficient and very effective. They will immediately convey new information to patients as well. So yeah, those are the kinds of efforts that we are doing to help patients with adherence.
Oh, that's actually very interesting. Having a WhatsApp group to kind of like broadcast, like
Yeah,
it's like an alarm or something like to reminder to
exactly.
get yeah, okay. So
Yeah.
it's like how does that WhatsApp group works? Because like it's like per um healthcare professional or it's like uh
Oh, okay. Most of the members are actually in the NGO, and then it is coordinated by the NGO personnel. So they take turns to remind the patient. So let's say all of us are on that are in that WhatsApp group. Maybe Boyi will remind those at 8 p.m. I will remind those at 9 p.m. You will remind those at 10 p.m. and Chelsea will remind those at 11 p.m. They take turns like that. Yeah.
oh, okay, that's interesting, interesting. Wow, okay.
Mhm.
Are they like usually referred? So for like these NGOs, so if let's say they have maybe issues with adherence, then they're referred to these NGOs to help them
Okay,
with
so
reminders.
Okay, so it works both ways. So if we identify the adherent issues first, and then we require their assistance, like let's say if the patient has problem with transportation, so they need money to pay the fare, so we will refer to the NGO. And then if the NGO identify the barrier first, and it involves like side effects of the medication, or maybe the patient refused to stop a supplement that might interfere with the medication, then they will refer to us. So it works both ways.
I think also speaking about NGOs also support. I think because we also mentioned quite a lot about stigma discrimination today for those who a bit more vulnerable. Um what I also want to probe a bit more on, I guess I think you also mentioned about economic issues, and one of them I mean you did mention just now was transportation. Are there any economic issues when in terms of the HIV/AIDS medication that a patient might be taking? And maybe because also why I want to know is because some places maybe might be subsidized, maybe not all. And sometimes let's say if they're not therapeutic enough, sometimes using novel medications are more expensive, and even that so might not be subsidized, and maybe in rural countries. So, is this a
Mhm.
concern in Malaysia?
Okay, so in Malaysia, the first line therapy is given free for citizens. And I think there is a difference between Sabah, Sarawak, and Malaysia, in and West Malaysia. So in Sabah, we give all heart for free, regardless if it's the first line or the second line. But we do have one patient last time with a third regimen, and he still got it for free, because we managed to get some financial aid for him. So it really depends. For those patients who managed to get financial aid, such as from Zakat or from their company, then it won't be an issue that much. But for those who are not able to get financial aid, then that would be an issue. But so far, from my experience, all of them are being assisted in Sabah. I'm not so sure in West Malaysia, because I heard in West Malaysia for second line, it is not fully subsidized for the whole year. There are a number of months where they need to pay. But in Sabah, for now, we are supplying patient with heart for free for first line and second line.
Okay, I think that's interesting. Maybe
Mm.
if you happen to know why also, actually I'm quite curious also why maybe different parts of Malaysia um for the provision of the medications, especially in HIV/AIDS, will be different.
I think it's more on how we manage the fund. And then, as you know, like in Malaysia, we have more rural and remote areas, and then it's quite difficult for them to get the financial aid to support their heart treatment if they don't get a full subsidy for the treatment. So yeah, that is something that we consider when deciding giving the second line for free. And then for now, we still can afford giving our patients for free, because um, there are not many of them who needs a second line.
Okay. So I think I would like to move on to maybe the pharmacist role in
Mhm.
there, especially I think you mentioned about the medication and therapy adherence clinic.
Yeah.
Yeah, so I mean I think we established that pharmacists actually play a very important role. I mean, not
Yes,
only
we
in
do.
the yeah, not only maybe in the medical context or maybe of adherence, but I think also because it
Mm.
kind of interlinks, right? So like maybe the biopsychosocial, emotional
Yep.
support. Yeah. So maybe I also want to hear a bit more because I think you also talk about how maybe as a pharmacist, they play a role as in I think the compliance assessment. So maybe you could elaborate a bit more about that for our listeners.
Okay, all right. So I'm gonna go through like the full process that we have in MTech, MTech RED. So we have three types of counseling. So we have pre-heart counseling, we have heart counseling, and we have compliance assessment. So during the pre-heart counseling, we check with the patients their level of understanding of the disease and the treatment, because they would have already been counseled by the counselor, the HIV counselor. So then when we meet them during the pre-heart counseling session, we will ask them again, and then we will explain to them again everything. HIV, the mode of transmission, what is AIDS, what is CD4, what is viral load, to make sure they fully understand about the disease and that heart is a lifelong treatment. Okay. And then during the pre-heart counseling, we also start patient with vitamin training. Um, so we have some time to start with the vitamin training, because in Malaysia, it really depends on the resources. If in a limited resource limited resource setting, the screening that I told you before, it might take some time. So we have some time for vitamin training. So this vitamin training is actually consists of vitamin C and folic acid, and they will mimic the schedule of the heart. Okay, and then also this one help the patient to train so that they can consistently follow the schedule. And then at this point also, we will identify what are the barriers to adherence. So then we can address these barriers to adherence before heart is started. Okay, so that is pre-heart. Then we move on to heart counseling after the vitamin training. The first thing we do, of course, we assess their adherence to vitamin training. And during the vitamin training, actually, we let patients to adjust their timing. So let's say during the pre-heart counseling, they decide to take at 8, but then they cannot follow. They can actually change the timing while they are on vitamin training and then tell us which time suit them best during the heart counseling. And then we proceed to counsel them how to take heart, what to do in case of side effects, and then educate them on drug interactions. And then we emphasize once again on the importance of adherence for treatment success. And then during the compliance assessment, we do it through self-verbal reporting by the patient. We check if the patient can identify their medications, and then we ask whether they have missed or delayed doses, and then whether they have started any new supplement or traditional medication. And then also if they have medication related issues, we will discuss with the patient during the compliance assessment. Yeah, that's the role of pharmacists in the MTech clinic.
Mm. Wow, I think this is very two-way because like I see like also the patient also taking ownership of their own
Yes,
how they take the medications. It's very in a way
yes,
you can go back and forth, and I guess in a way that's how you also build rapport. I just also want to understand because of this whole
exactly.
process, right? Is like these three types. Actually, how long would they be taking it like the vitamin training like for to assess the adherence and
Okay, so
essentially yeah.
so you're asking how long the vitamin training?
Yeah, like it seems like a process that might take some time before they actually go on the heart, right?
Okay, so last time it used to take a long time until the patient is ready, but because now there are studies that show that it is better to start patient regardless of CD4. So we tend to start heart as soon as possible. So for those who do not have any infection, we just give the patient vitamin training for about a week until we get the full result for all the screening. And for those who are on treatment for infection, we will wait for at least 2 weeks until the treatment has settled the infection. So during the 2 weeks, the patient will have the vitamin training.
Okay, yeah. Okay, so I think also because like when we're talking about adherence, because like um this is at the start, right? And sometimes maybe often not, maybe sometimes the busy lives or that we have to work, or maybe just emotionally sometimes need more support and maybe they may not be adherent maybe towards some time throughout their journey. Are there ways to detect on their progress? Because I think also at the start we will say like, oh, we need to see whether they're ready, and also we check whether through the vitamin training if there's also been
Yep.
any issues also from the compliance assessment. So are there ways for you to also check along the way, and maybe also how often do you review these patients, right, to see if they're doing well, especially in the
Mhm.
adherence?
Okay, so let's start with how often do we see this patient, right? So those who just started heart, those who are newly being diagnosed, we can see them as often as every 2 weeks until they are stable. Stable in terms of the blood investigations. Let's say we see there is no problem with the liver and the kidney, then we will extend the appointment to 1 month, and then if their conditions got better, to 3 months, and then every 6 months. So for the stable patient, we will see them at least twice a year. Okay. So you are right. There are conditions where life situation affects their adherence. You see patients who are very well, you see them every time, but then suddenly something happened, and then you can see that the CD4 start to drop, and then the viral load start to be detectable. So that is one of the way we detect how the patient is doing, other than asking them verbally. Because sometimes, patient, when you ask, how are you doing? Have you missed any dose or delay? I actually delay for about 5 minutes. And then you say, okay, so 5 minutes, what happened before this? It was always like on time. Oh, actually, I just changed, let's say, switch job, and then I got really tired from the new job. So then I kind of delayed a bit. 5 minutes is actually not too bad, but you see, if you let them, if you allow the 5 minutes, later it will be 15 minutes, and later it will be 30 minutes, and then they will start to delay it even further. So that's when you detect it early. Just say, okay, so 5 minutes shouldn't be a problem, but the best thing is to be really, really on time. So do you need to adjust your medication maybe to a later time that is more suitable, or are you comfortable with maintaining the current timing? So that is one way of seeing it, by asking the patient. And then another thing is by seeing of course, the CD4 and the viral load results. And then, yeah, you should start asking whether there is any case of non-adherence, if anything changed in the patient's schedule, and also if they are taking any medications or any supplements, or even food that might interact with our medications. And when asking, we explain to them why we are asking. Like, I am asking you about this, the supplements or the food you are taking, because they might interfere with your medication, because we are seeing your levels are changing. Your CD4 are going down, your viral load are starting to be detectable. So that's how you assess your patient, and then counsel them further, and then find out what are the reasons behind those changes.
Yeah, I think you definitely need to provide context also for these patients also to give them a bit of a better understanding.
Mhm.
Also maybe also why we're asking these questions. I think a very famous question of when I was doing my internship, I was like, oh, why are you asking so many questions? So yeah, I need to give them that context that is actually quite important
Yes,
just to give them
yes.
yeah. Um Actually, I'm just also wondering because we were also talking about your I think the HIV clinic, right? So do you
Mhm.
does the HIV clinic also see a lot of maybe the vulnerable groups that I think we also mentioned earlier on, like maybe like those who maybe are sex workers, um then also because I think also I also learned this quite recently because like I think in Singapore sometimes we do have an STI clinic, right, but it's actually more often
Yeah.
not they actually go down to the red light district to see some of these workers who are a bit more prone susceptible to these diseases. So I'm just wondering,
Yes.
are there initiatives like that also? And maybe do we in Malaysia and do we see are a lot of these vulnerable groups frequently?
Oh, yes, yes. We do have a lot of vulnerable groups in our clinic. But when it comes to like going on site, I don't do that. Those are the job of we call them the public health officers. So they are the ones who go into the field and find the vulnerable populations, and yeah.
So my question is also because on adherence. So maybe I just wanted, yeah, to know, or especially for these vulnerable groups, right? So, has the adherence programs offered has proven successful for these vulnerable groups as well? And maybe are there any other improvements that do you think need to be made for these vulnerable groups, especially in the adherence?
Okay. So, for the vulnerable groups, right, they have specific needs, you see. So, I think in terms of the MTech, what we could provide them is a safe space. And by having their confidence, actually, we are helping with the adherence as well. Because the vulnerable populations, they do not really have a lot of safe space to share their concerns. So we make sure that MTech is one of them. So it works well because they know we are one of those few that they can turn to when they have concern on their condition. So yeah, does that answer your question?
Yeah, yeah. And I think I want to elaborate a bit more on that because
Mhm,
I mean in maybe in terms of general, yeah, we want to provide a general safe space for our patients because that's where they can
mhm.
maybe let us know more information that could
Yep.
maybe give us better insight to maybe what an issue is, or maybe I think in this case when we talk about adherence, or maybe talking
Mhm.
about if there's a need to referral. No, so maybe because this podcast is also about patient counseling. So maybe
Yep.
what are some ways that you as a healthcare professional, as a pharmacist, provide that safe space for your patient?
Mhm. Okay, so when it comes to providing safe space, we ensure that we provide care that do not judge these patients, and then we ensure that they are being treated with respect and dignity. And then we also ensure that they are confident that their privacy is being protected. So these are the basic things that is very, very important. So even when I do workshop for the other pharmacists, these are the things, the basic things that I will cover a lot because sometimes, although this is very basic, but sometimes we take these things lightly. But actually, it plays an important role um, for your patient, like for the adherence.
Oh, right. So, I mean, they have different populations face unique challenges, right? So maybe you
Mhm.
can share your insight on the specific needs for the certain key groups like the HIV positive mother and how might they differ from others?
Okay, so when it comes to HIV positive mothers, nowadays we can actually provide treatment to prevent from the children getting HIV. Like I mentioned before, we provide HIV prophylaxis for the infants, as well as for newly diagnosed mother. We will start the mother immediately with heart so that they will not transmit the HIV to the fetus. But in terms of special program uh, that covers social needs, I'm not too sure. But yeah, in terms of treatment, we start immediately for HIV, newly diagnosed HIV mother. So we will prevent the transmission from mother to child.
Right. So are there any particular gaps in the service or resources that you observe for these groups?
For mothers, we actually prioritize them. Yeah, for mothers. So that's why you are seeing the elimination of mother to child transmission because we prioritize mothers with HIV.
So for now, do you think that enough focus on addressing the stigma or ensuring the equal access to care for those vulnerable groups?
Yes, actually, we are still doing the effort to reduce the stigma, but this is like something that we need to do continuously over the years, because yeah, people need to be continuously educated and be reminded that HIV exists, and we each of us have a role to prevent it from rising further. Yeah.
Okay, so in terms of the pharmacist role, can you share us some of the initiative or strategy you have been working on to address this specific need for those vulnerable groups?
Okay, so in terms of the key populations, right, I don't really have any specific program for specific key population group. But what we are doing in my clinic is that we have a database using an Excel sheet. So what we do is we track the CD4 and the viral load with this Excel sheet. It has a color-coded system whereby the patient who has increasing viral load will be highlighted in red, and then those who has reducing CD4 count will be highlighted in yellow. So what we do is these visual cues actually assist us to detect which patient requires more attention. So then we can prioritize this patient and find what are the barriers to their concerning CD4 and viral load level. So then from there, we can from knowing the barriers, we can proceed to the next step, which might be unique to each of the patient. Yeah.
Oh, I see. So yeah, they have the limited access to the healthcare can be a significant barrier for some population. Can you tell us more about how your team tackle this challenge?
You mean the access
Yeah.
to the care? Okay, all right. So this goes back to when I first started the HIV clinic in Queen Elizabeth Hospital. So back then, there were very few clinics around in Sabah. And then we started to do trainings for other pharmacists in other districts. So currently, if I'm not mistaken, we already have around eight clinics with HIV MTech in Sabah. And then we also do workshops for other pharmacists who do not run HIV clinic, but has the possibility of encountering these patients so that they are also equipped with the sufficient knowledge. Because you see, we have really very limited resources. So that's what we can do to ensure that we can cover many patients. Like we can educate as many patients we can by educating other pharmacists to to manage HIV cases.
Okay. So you mentions that have many news registered pharmacy may not be fully gaps on the scope of the HIV problems.
Yeah.
So how can this lack of the awareness impact their effectiveness in providing the care?
Okay, so you are saying about newly registered pharmacists, isn't it? Okay, so for newly registered pharmacists, I think their main challenge when facing HIV cases is that they are not very familiar with HIV, and then they may fear of saying something that might offend the patient because these patients are key populations, vulnerable populations, right? Actually, this is understandable because HIV is a highly specialized area in healthcare, right? So, so how you can actually address this issue, like this challenge as a newly pharmacist when you are a student, try to understand a bit about HIV, at least know what is HIV, how it is transmitted, and what are the prevention methods, and also know a bit about the treatment, at least the first line. And then I think it is also important to develop communication skill. And like maybe you can volunteer or do community service, even if it is not related to HIV. For instance, when I was a student like you guys, I used to volunteer a lot in the rural and also the Aboriginal villages. So I think that was the point of my time as a student that helped me build empathy and as well helped me to better connect with my patient now.
So, I just wondering, are there any specific skill or area of the knowledge that you believe that the pharmacy student need to focus on to prepare themselves for working into the HIV?
Yeah, I think the most important thing is the communication skill because the more detail knowledge will come with experience. Really, it's really your communication skill. And then in my experience, right, you will see different people, and then they will let's say respond to you differently. So you have to sort of tune your way differently for different people. Like maybe for transgender, you can be more like sassy or something like that, so that the conversation flow and don't be too monotonous, and try to find common grounds. Let's say maybe they like an artist that you like, right? That's how you start conversation, and then you divert the conversation to the treatment, to the HIV management part. And then, yeah, I think communication is my number one priority that I highly recommend students to build on during the studies before going to the working environment.
See. So if the pharmacy student in particularly patients about contribute to the HIV care, So what advice could you give them to start a meaningful impact?
Okay, so the student is passionate about HIV, isn't it? Okay,
Mm,
so I think you can start by volunteering actually. Start to be involved in activities that involves HIV. Like maybe you can start as simple as run or maybe a community service like that. And in some programs that I went to, you see, there are programs where the HIV patient actually openly share the experience about how they were first diagnosed and then what kind of challenges they face. And this actually helps to build your empathy as a student. So then you know when you step into the working world and then when you encounter the HIV patient, you know that okay, this population actually they have their own story, and then you should be open to whatever they are going to tell you, and then you need to understand the barriers, and then yeah, you will be able to understand more if you have the experience of listening to their stories before you step into the working world.
right. So, is there you have any suggested voluntary program or the organizations for the pharmacists to involve for the student? Yeah.
I'm not too sure about that. From what I know, from what I know, there is no specific NGO for student, but the NGOs are usually very active. Yeah, but I'm not sure. I'm not sure if there is any NGO that is suitable for students. But they do a lot of awareness program that you can actually join. Yeah.
So yeah, we're coming to the end of our podcast. Okay. So
Yeah.
in this episode, we have discussed the critical roles of the pharmacists and the healthcare professionals in combating the HIV or AIDS in the Malaysias, highlighting the progress, challenges, and innovative solutions. Malaysians have made a significant improvement in managing the HIV, such as providing the free first-line antiretrovirus therapy. However, the journeys toward the United States 95 targets remains challenging. With the current rate at 84%, knowing their status, 68% receiving the treatments, and the 99 achieving virus suppressions. The key hurdles include the stigma, discriminations, economy constraints, and the geographically barriers, particularly in the rural area. All right. So we also have discussed the importance of the personalized care, counselings, and the adherence support.
Yeah.
Efforts including the empowers patients through the educations, free pills boxes, and the WhatsApp reminders groups. Collaborations with the NGOs provide the holistic care, addressing the social and the financial needs, transportations, and the free space for the vulnerable populations. Yeah, so the awareness campaigns, especially for the social medias, is targeted for the youngest demographics. Another interesting information on the pharmacy counseling process from the pre-heart to ongoing adherence assessment and the vital role of the trust and respect in the patient's care. We also spotlight the critical efforts in the Malaysias to prevent the mother-to-children's transmission of the HIV and enhance the care for the HIV-positive mothers. While addressing the stigma remains a long-term effort that require continuous commitment for all levels of the society, as well as the innovative approach to manage the HIV care, including a database system using the color code visual tool to prioritize the patient effectively. By empowering small pharmacies that aims to extend the reach of the quality care, and educate to both the patients' populations. So the convocations also highlight the importance of empathy and communication skill in supporting the HIV patients. Okay, so yeah, your insights today have been inspiring for the student to embrace the lifelong learnings, explore the evolving landscape of the HIV care to find the innovative way to improve the treatments, adherence, provide the compassion counseling for our students and make a meaningful difference in the life of the patients affected HIV and also the AIDS. As we will conclude, could you share a closing statement or any last piece of advice for our IPSF APRO member?
Okay, for students, I highly recommend that you expose yourself to learning about HIV because it is very, very interesting. And then we as pharmacists in the working world, we have a lot of role to play in combating HIV. So I am very happy to be invited to this podcast and be able to share with you my experiences and the knowledge. And yeah, I hope all of you can benefit from my sharing, and maybe those of you who has found their patient and their passion in managing HIV could be inspired more to contribute into combating HIV epidemic.
Yeah, sure. I think that our members should get your message clearly so they can prepare themselves for their future. And we want to thank you, Ms. Haizia, for allowing us to interview you today, and we wish you best of the luck for your future. For those who hear the
Yes.
episode, please do stay tuned for the next episode where we will invite the professionals to their journey in the professionals world. This is Julian and Bobby signing off. See you in the next episode.